So it's 1 o'clock. We're going to get started, everyone. Good afternoon and welcome to today's webinar on rethinking well-being in the evolving workplace. My name is Siobhan Torres and I'm with the Massachusetts Department of Public Health. And I, along with my colleague, Suzanne Nobrega from the Center for the Promotion of Health in the New England Workplace, will be moderating today's webinar. And we are so excited that you can join us today and are thrilled to have Dr. Michelle Robertson with us to speak on this very important topic of hybrid office environments and how employers can protect and promote the health and well-being of the workforce. Next slide, please. Now, before we begin, I am quickly going to go over a few housekeeping items so we all have a seamless webinar experience. To reduce background noise, please keep your audio muted during the webinar. At any point during the webinar, you can submit questions to today's presenters by typing your questions in the chat box. We will be pausing at certain points throughout the presentation to answer those questions. Today's webinar is also being recorded. By continuing to be in this webinar, you are consenting to the recording. The recording of the webinar will be available both on the Working on Wellness and CPH-NEW's website, and we will share the link to both sites in a moment. We will also be emailing an abbreviated version of the slides to all attendees after the webinar. And lastly, if you are experiencing any technical issues, just let us know via the chat box and we will help you resolve those. Next slide, please. I do want to share that this webinar was organized jointly by the Massachusetts Department of Public Health's Working on Wellness program and the Center for the Promotion of Health in the New England Workplace. Very briefly, we would like to highlight some resources available through DPH and CPH-NEW to help employers create a healthy and safe work environment. And one of these resources is the Working on Wellness, which is a program of the Massachusetts Department of Public Health that helps worksites launch or enhance their wellness initiatives. And as part of the WELL program, we offer a free self-directed online training program that walks employers through a series of steps for building a worksite wellness program. We also host quarterly webinars on a variety of different wellness and safety topics, such as today's webinar. So I encourage all of you to visit our website at www.mawow.org and explore the self-directed training and some of our other resources, including the Healthy Workplaces Toolbox, which contains online resources like toolkits and assessment tools to help worksites reach their wellness initiative goals. And so now I'm going to turn it over to Suzanne to tell you a little bit about CPH-NEW and introduce our presenter.
All right, very good. Thanks so much. So I am the Outreach Director with the Center for Promotion of Health in the New England Workplace. It's a long name and we call it CPH-NEW for short. We are one of 10 centers of excellence for total worker health that is funded by NIOSH, which is an agency within the Centers for Disease Control and Prevention. We are a joint effort between the University of Massachusetts Lowell and the University of Connecticut. Our center conducts research with working people and with employers to identify ways to improve workplace safety and well-being issues using a total worker health approach. Total worker health is defined by NIOSH as policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. And our center also offers total worker health program toolkits, which you can check out on our website, as you see here on this page. And we also offer continuing education, publications that might be useful for you, and a mailing list in case you'd like to stay informed. So with that, I would like to now introduce our speaker for today, which is a close colleague of mine. I'm super grateful and excited that she is here to talk about hybrid workplaces. So Michelle Robertson is an experienced research scientist. She is an affiliate of our research center and has been collaborating with us for about 10 years and continues to. She is also the executive director of the Office Ergonomics Research Committee, which I understand is an international group. And she also lectures both at Northeastern University and the School of Business, as well as UC Berkeley in California in the Occupational and Environmental Health Division. She has dedicated more than 20 years of her career in systematically designing and evaluation organizational and training interventions that include participatory and macroergonomic approaches, work organization factors, and designing integrated wellness and ergonomics programs. So Dr. Robertson is working, as I mentioned earlier, with CPH-NEW, and so she brings us her technical expertise on this topic here today, and she's going to share her most current research. So Michelle, I will allow you to take over control of the slides.
Thank you, Suzanne. Good day, everyone, and I thoroughly thank CPH-NEW and Siobhan and her organization for allowing me to share my experiences in my study with everyone. We're going to be discussing what are some of the challenges of telework and virtual office, put this in the context of a work systems perspective. Then I have a virtual office intervention study that I'm going to share with everyone. And in between these, we've got some polling questions and some interaction activities that we're going to get some feedback from all of you. And then we'll wrap it up with practical implications and programmatic recommendations. So pulling all of this material together. One thing that's important is we've learned a lot about telework and remote work. And what over the years, we have found some very specific challenges and benefits of telework. Interesting over the years, there's an insufficient amount of kind of research because we see mixed effects. We see positive and negative effects for employers and employees regarding their well-being, safety, and performance effects. Questions come up of how to manage telework, such as distance managing, how to best address safety and health and ergonomics concerns. So how do we take those factors? How do we glean what we have seen from successful VO programs to help us provide some guidance to managers and all of us in the area of occupational safety and health and ergonomics? Interesting, as we looked at the research over the many years, one thing that really came up to the top of the whole literature search and the review is planning and evaluating a program. And planning means setting up who's going to be involved and how we're going to evaluate the program. So we can do some course corrections, find out feasibilities. And there's many questions that needed to be asked, such as identifying the right people that their jobs, their skills are amenable to allow them into a telework situation. Another area that was important is defining the level of formal policies. It's sort of a continuum, what we saw in the literature. One is kind of the informal policy that managers would let them go home, to a very formalized policy with a union management agreement, with lots of operating rules and procedures. So we saw both. And what was also important was that commitment from senior managers, also working with legal issues of people working at home, and human resources also brought in very important considerations, such as who are the right people to work at home? Is it the right time in their career to work at home? Then you answer the questions of how do we train people and we send them home, not only on ergonomic assessments, but just how to time management and how to be an effective teleworker. What are the roles expectations of your managers and you, and how often you're going to communicate, which leads into how teams work together. There's norms of teams and how you share those experiences of team working together. Now that we're in the digital age, how do you pull those teams together? Also important in human resources is inclusion, the belonging, and the fairness. Who gets selected to go home? It was an important issue to look at. Then we had the whole technology issue. Just as you saw me, trying to pull things together here, we have information technology infrastructure that also needs to be created along with these other successful programmatic elements. But telework isn't for everyone until COVID-19 and the pandemic hit. Then it was mandatory. So we saw a shift that was occurring here. So I'd like to walk you through just several of the challenges that have emerged over the years. And many of us are experiencing these now. And then when we move into setting up our policies and our practices, we need to consider these. So when we're looking at lack of social interaction, I think we can all relate to those. Changes in job autonomy, role expectations are very important to establish between managers and employees. Then you move into the distance management. The role of the manager has significantly changed, and how do they manage their teleworkers so that they're safe and healthy and also productive. There's an absence of mentoring because now you're out of sight, out of mind. So that's another important aspect of management. Collaborative and teamwork, how do you pull those teams together? And the interaction of those teams, how they're supported through technology, but also maybe as we move into the hybrid situation, how do teams decide when they're going to come together, and how do we support that work environment, allow them to come back into work, into a safe working environment. It's been self-reported for many years that as people have been working at home, you have the flexibility, but you also have this global clock. So 24/7, people really feel that, yes, I'm flexible during the day, but they also report that their work hours have been extended. So it may not be a true 8-hour day. So this moves into a self-reported workload, increased workload. Now you're working in a work environment full time in your home environment. Do you have the right resources, the equipment to support doing your work? The work-life balance, this is a big issue of when can you disengage from work? When do you have the flexibility? And working those together, this is where the manager, communication, and expectations are important. Setting up healthy computing and those habits that we've all are concerned, aware of, static working postures, proper equipment to support healthy computing behaviors. The digital age and technology was important, which also was the internet and security. Now we're all doing VPNs into making sure that our data is taken care of safely. So I'm going to move it over now to Suzanne. She's going to do a polling and we'll get some results from those. Suzanne.
Yeah, sure. And hold those slides right there, Michelle. So all of you probably answered this question when you registered for the webinar, but you never got to see the results. So we wanted you to see kind of where do we as a group on this call stand in regard to our own work situations and just how common the hybrid work environment is. All right, coming in, we've got 52. We've got about 60 some odd people on this call. So looking like very few people working on site most of the time. All right, almost 40% working remotely all the time, but a good solid 50% of us are in this hybrid situation. So we do hope that what we are going to talk about on the call today is relevant both for you and for the people that you might have responsibility for in relation to safety and well-being. Okay, so Michelle, let's.
Fascinating. Thank you, everyone. Okay. So let's take a step back and kind of look at this whole phenomena of just working from home within a systems perspective. We as employees are in the middle, and so we are being bombarded by many different tasks, organizational structures, teams, and technologies. So what's important is to take a holistic perspective because these interactions are extremely important and how they impact on how we work. So I'm going to walk through each one of these a little bit and talk about them in an organizational level, in a group level, and an individual level. And so what's important is that as we understand the organizational design and structure, this is needing to be changed. Now we need more flexible organizational structure and processes. Personnel means bringing in the human resources and the training and the skills and the knowledge that those individuals need to do in order to manage teleworkers and hybrid workers, and the technology that needs to be in place to allow people to work effectively and safely in either their home environment, and now we're moving back into the workplace. So as we look at the group areas, we have the psychosocial. We talked about looking at the social isolation. Now it's important, how do we bring the teams together? How do we support them with the technology? How does management support them? And from a health and safety perspective, how do we make sure that possibly setting up training programs to allow people to create a network to get some feedback from their team mates about how they're working virtually and setting up all of those other important cohesiveness, group cohesiveness. In the physical environment, on the individual level, is our typical workstation design, our chairs and our physical environment, the technology that we use, our skills, our training, looking at the job design, job autonomy and flexibility, and also looking at individual differences. There are preferences. Some people really prefer working from home 8 hours a day. Other people like to get out of the office and have a blending. Now that we're emerging out of the COVID, there's going to be this balance of how do we make the right combination so that people feel they can work together as well as individually. The external environment, the best example I can give you is our COVID. It really turned all our workplaces upside down and how we need to work with them. So as we're looking at individual differences, this is breaking down the system's components. We have the workstation design. We look at technology. This gets into usability and how to use it, personnel training, performance aids. Here are our psychosocial and work organizational variables, as we were talking about decision-making, job control. All of those change very much when we're either in a hybrid situation because you're still having to monitor what you are doing and you have to balance it with your other teammates. And then we need to, since we want to be a successful program, whether hybrid, full-time, remote, we need to look at the evaluation. How is it impacting performance, comfort, job satisfaction, quality of work life? So as we move on into the group area, we're concerned with team synergy, the co-worker support, how do management support those teams themselves. There's also this issue of work performance contracts. What are your role expectations? And let's not forget those culture and social norms, and those are strong drivers. Technology is important to look at our groupware. We're using technology right now with Zoom, and then we need to look at those outcome variables. And as we look at the organizational level, who needs to be involved here? Is we need to bring in our human resources, we need senior management support, financial resources, organizational policies and procedures need to be established and well communicated. Personnel and systems training, job performance. We also need to bring in our safety and ergonomic training so that there's not only the awareness of how the organization is going to support, but this gets down to support of equipment, resources, financial costs. As technology is changing, we need those online support. And then we need to look at what those effectiveness outcomes are. If we have a client relationship, we can set up balanced scorecards, understand our operational excellence of the overall organization. So this is the systems model, and it's going to be driving some of our research. And now what I'm going to move into is looking at one particular intervention study that we did. So taking that systems approach, one thing that we had noticed in the literature is that there were very few studies that really looked at the long-term effect of a telework condition, virtual office compared to a control group. So when we say virtual office, telework, those terms are interchangeably. So what was really became clear in the literature was this need for a systems approach. So we embarked on a study where we were examining the effects of a virtual office on office workers. Here are our outcome variables: psychosocial, the mental and physical well-being, workplace satisfaction and performance. And we were comparing these to a control environment, a conventional office. These study findings that we have, along with the models that we've put together and the literature, is allowing us to come up with some guidance here. And we certainly understand that there's an immediate abrupt shift to what we call the nature of the work system due to our COVID-19. So we're learning, but I think we have some really good research results that we can move into some guidance. So here's the model that drove the research study. It was a virtual office study. This study embarked before COVID hit. Literally, we were done with the study about 6 months before COVID. So this organization, a public sector organization, was embarking on seeing how they could design the most effective and successful virtual office experience. What were some of the key attributes that they need to look at before they implemented it on a large scale? So with virtual office, it was a new work style. They were going home full-time. They were trained, all managers and employees were trained on what they called performance management agreements. This was also an agreement with union and labor. And so it was ensuring that with this 3-hour training, that the managers and the employees were well aware of looking at their lifestyles, looking at how they were working at home, role expectation, what do they mean by job flexibility and the control, as well as that they were receiving ergonomics training, how to set up their workspace at home. And we also were looking at the satisfaction of their workspace. The conventional office also received ergonomics training for their particular work environment. In the middle here is that we receive resources are being provided. One of them is the control over your work environment. This is what we call environmental control. I have the skills and the knowledge how to set up my work environment. I have my expectations for my manager, so I know how to interact with my manager as well as my team. And then we move into the demands. We're having to adapt to a new work environment and new group interactions and supervisory relations. Here are the outcome variables that we measured, ranging from physiological, psychological, psychosocial, and performance. Our hypotheses were with the VO group, they're going to report an enhanced job control. So they're going to report a greater group participation and interaction. They're going to have a more positive VO experience in terms of quality of supervision and work-life balance, such as less work interruptions, greater workspace satisfaction due to the fact that the training is allowing them to set up their work environment to fit them and their work needs, less reported musculoskeletal discomfort, less mental and physical stress, and along with commuting fatigue. And as a performance indicator, we used customer satisfaction, saying that the conventional office and the VO office were both going to have positive client relationships. It was a prospective study, repeated measures. It was over a 12-month period. We did pre and post measures. And we also included some focus groups at the end, and employees and managers were involved. And our sample sizes were reasonably large, so we were able to get some differences and note those differences between the groups. The VO steering committee, and why we asked that question, is what this team, this organization set up were several sub-teams, an IT training, the management training, ergonomic training, how were they going to communicate, the whole process of the VO with people that were in a VO or in the conventional office. The measures were economic measures. Those were the KPIs. So there was a team looking at those, and then formal rules and procedures. As I mentioned with the training, that this is what it involved. And we also had that union management arrangement. Minimum equipment was sent home with the VOs, a laptop printer, the cell phone, and a filing cabinet. Here are the variables that we measured, the control variables. This was important for us to have. Different perceptions could be interfering with the true intervention effects. So we wanted to make sure that we're getting the attitude of the virtual office prior to the actual intervention itself. Those ended up being our control variables. We had psychosocial variables. As you can see, there's many of them here, the work environment, workspace supervision, and then the performance and well-being outcomes. What did we find? Well, one of the first results that we were looking at was this job control. Again, remember we hypothesized that people were going to have a greater sense of control over their job as well as their physical environment. And this indeed, we saw significant differences here. We saw significant differences between group participation, as well as decision-making, group interaction, and cohesiveness. We also looked at supervisory and work organization. So with supervisory quality, there was a significant difference here, with supervisory quality higher for the VO participants. There was no significant difference in work interruptions between the two groups, and there was no difference with the number of rest breaks that were skipped, and those are scheduled work breaks. Self-reported workspace satisfaction. They had reported a greater workspace design satisfaction, that significant differences. The VO, again, this is probably due to the fact that they were able to have a sense of control over their work environment and be able to set it up to meet their work needs and ergonomic needs. Looking at musculoskeletal discomfort, we saw a difference between the upper body symptoms. This was a yes-no response, was not a continuous scale, Likert scale. And the lower body symptoms, we saw no differences here. Probably the upper body, again, is that people were able to arrange their workspace to fit them. When we looked at physical and mental stress, both for the VO group, we saw a reduction in physical and mental stress. No difference on the mental commuting fatigue, but there was a difference for the physical commuting fatigue. And customer satisfaction, this was our surrogate of performance measures. It was greater significant difference for VO group versus the conventional office group. So what's nice about that is that we can reflect that the VO, there was no kind of decrease in that performance, that they had good customer relations. And that's what this particular public service organization was providing, internal service support for the organization. In our focus groups, the VO participants, the employees themselves, made these notes, and it was observed that they were more flexible to accommodate their work life. They were able to manage their workload. And they said that it was really important for them to learn how to manage that groupware technologies. The managers expressed that they noted and observed that their employees' behavior became more results-oriented. And they said that was probably because that 3-hour training helped them sit down with your employee one-on-one and go through role expectations so that they could kind of set up what their goals were, how often they were going to communicate with each other. So I thought this is an interesting quote, is moving into that level of trust. And that's the social norms, that's the organizational trust. Is that if you understand those role expectations, then we need to move into what are the regular communication patterns and also how to maintain that sense of connection. So it was interesting, the managers were observing, and this was a true participatory bottom-up kind of approach, where the groups themselves were trying to create kind of unique ways of connecting. So they did it through newsletters, had conference calls, they planned for parties. They would send birthday cards around to each other. And then it started moving into that they were creating their own agendas and managing the teleconferences much more effectively. And managers were also noting that there was an increase in the quality of communication. So in summary, VO, it was observed that there was a positive impact on the employees' well-being and performance. The intervention appears to have enhanced the job control, participation, decision-making, and that interaction and cohesiveness. Again, this is probably due to the training where they were able to set those role expectations, how often did they need to reach out to their team. Therefore, it led into an improved supervisory quality because there was more relationship and communication about the job. This also was making sure that they were well satisfied with their workspace setup. Did they need any more help? Resources there. We saw fewer symptoms in the upper body and those reduced physical and mental stress in the physical commuting. Customer satisfaction, this was important for them to look at those measures. And as we start aligning and looking at the business goals, the strategic directions, and what those survey outcomes, there was a linkage that was occurring there. Those were the business operational expenses and their kind of cost savings there. Those were internal to the organization, but those were the measures that that economic team was looking at. Every study has a limitation. It was a non-randomized. We had subjective ratings. The strengths is we took a work systems approach. We had training. It was a long-term intervention study. We had a control group, and we also had high participation and senior management and union support. I'm going to pause there and take some questions, and then we're going to move into our second poll. Suzanne, are you there?
This is Siobhan, Michelle. I don't see any questions. Oh.
Okay, great.
Yeah, I don't. There's one comment in the chat from Casey. She would love a copy of this study. And I was wondering, is the publication available and is that shareable?
It's under review, and I'll be more than happy to share it with you when it gets published. And what I would ask Siobhan and Suzanne, they have the list of our participants, and we'll definitely put that forward and out there. The systems model, I do have a publication. We just presented that at the IEA Congress, International Ergonomics Association Congress. And we took the model and we actually compared it to the Netherlands and Brazil and just kind of got some culture differences. So that might be of interest to you as well.
Thanks, Michelle. We also have a question from Christine. Were individuals in the virtual office environment provided with ergo equipment for their home office?
Very minimal equipment. This was a pretty streamlined public service organization. So they were able to take home their laptop, their printer, they had a cell phone, and they had some storage units. So not a chair, not a sit-stand workstation. Their idea was that if it was a successful program and they could look at the budget, corporate real estate, when they were deciding how much they're going to shift some of the work at home and then how much of it was going to go to the office. I think they were doing a cost benefit analysis, hopefully to maybe encourage the purchasing of more equipment. And another point I'd like to make is what was interesting as the reflections in the focus group was that once they kind of finished the study, they were saying, you know, our team would like to meet 1 day a week, and we would like to come back to our office with a particular task and focus So where are we going to work when we come back? We don't need to go to our individual workstations. So corporate real estate, that's why it's important to have them as part of the kind of the Telework steering committee. We're saying we need to create collaborative workspaces that are going to support teams and huddles and small working groups. So this is also starting to shift when we talk about it in the hybrid model. The teams were deciding it's going to be Wednesday or it's going to be a Thursday. We're going to come together. This is what we're going to focus on. And that was all part of what managers were observing, that they were becoming very goal-oriented, setting up their agendas. And now we got the physical space of we want to welcome those people back to the workplace so that they have effective face-to-face interaction in a very safe environment.
Thanks, Michelle. There are a couple of other questions that came in, but we're going to move on to poll number 2, and then we'll get back to those before the end of the presentation. Okay. And I'll turn it over to Suzanne.
I hope my audio is working. My chat froze up. Here we are. Yay, technology.
Technology.
Okay, so Michelle talked about a lot of organization that occurred within the study sites as they kicked off this effort, and we wanted to poll this group to see. Michelle, could you advance the slide 1?
Yes, thank you. Here we are.
Question for the poll. Do you have a working committee designated to address the issues regarding new ways of working? Bryan, maybe you could let me know when that's ready. I'm having some interface problems on my own screen. So maybe Siobhan, you can, once those results are shared, you can narrate since you'll be able to see the responses.
Teamwork.
Okay.
All right.
Okay, so the results show that, let's see, 37% have replied that yes, they already have a committee in place. 4% say yes, we're starting one soon, but the majority of the people, 48%, say no, and 12% are not sure.
Okay, very good. So then the next question, Michelle, if you could advance one more slide. We're curious, for those of you who are doing this or do plan to do it, what kinds of people are you inviting to be part of that process? And we invite you to submit you can share within the chat. And then everybody else could see kind of how you're going about doing it.
Excellent. Thank you. Okay, as we're looking at that, I'd like to walk you through kind of taking a step back, pulling in our study results, as well as the literature and the model. I want to walk you through some of kind of a general areas of what we need to look at as we plan, implement, and evaluate. What's important here is that we have this continuum. And there's, at one end, is the in-person conventional office, if you want to call it. At the other end, we have remote, virtual office, and working from anywhere. And this was also starting to emerge in many organizations. It didn't mean that they were going to work from home, but they may actually be working at a satellite hub where they would meet with teams together that were working on a particular project. So it moves back into the middle. You have this hybrid, flexible type of work arrangement. Now, we don't know, is it 1 day, 2 days, 3 days a week? The research is still out, where we need to learn more about it. What we did see with the VO study was that as the VO participants, after a year, they were reflecting how they felt it was important for them to come together at least 1 day a week. People are saying, if I have control over it, when I go into my hybrid setting, do I need to work with my teams and decide how and when I'm going to do that? So this moves into what we call organizational readiness. How is the organization going to prepare their workers and their teams to come back to the organization actually establish where they're going to work, make sure that all our COVID health and safety requirements are in place, well communicated, but the support and the resources goes across. So you have the technology that they're going to need to have, the equipment, it can be the ergonomic equipment, purchasing. Are they going to have to bring in new equipment, new software technologies, new kind of huddle rooms? So that is all kind of that turnkey purchasing part. And another area that was indicated in the literature, but now is really moving in, is the whole, what we call the shifting of the cost, the compensation. If I'm working from home, then my heating, air conditioning costs are going to go up because I'm going to have to cool it or keep my house warm. So there's going to be some shifting of cost. Now, when you're doing work from anywhere, your shifting of costs is that you might be able to move to another geographic location where the housing cost is not as high. But you need to balance that with, you don't want the burden to move to the employees, all of it, whereas corporate real estate is reducing the number of offices and their real estate. There needs to be an economic team that's looking at these shifting of costs. Therefore, it's important to involve those key stakeholders. And this is management and union, the IT, those measures, and this is a continuous process. That's why this organization undertook this particular study, because they wanted to evaluate, learn, and adapt the program. We're going to need to do this in this environment. We're going to have to help managers understand how that distance learning is and those communication patterns. Then as you look at the jobs themselves, as we're going into this hybrid, flexible kind of work style, which jobs are going to be best to allow people to work from another location? So aligning it with the business strategies are very important. So do you have asynchronous or synchronous type of communication, meaning that if it's a global organization, you need to be aware of 24/7, of different time zones. How do you share that information? Timing is critical. So if everyone needs to be together, so it's a synchronous discussion, then that's where the support needs to be from the work organization and the manager. This is why sometimes satellite hubs may start emerging, and that's also considered a hybrid type of work environment. How do I share the information? How do I collaborate and set up my coworker support? And it's a degree again. There could be a high level of collaboration, medium, and it really depends on what the task and the activities are. If we look at teamwork, we find that teams kind of come together, bursts of energy, and then they go off, possibly go back to their home environment and do heads down work, and then they come back again. And so the technology will allow for that communication, but you need to think about how you're going to get that supported. Informal learning, onboarding, and what we call career extending benefits. Now the possibility that people who are at the end of their career can become really important mentors to help the onboarding for the new employees coming in. There's a lot of informal learning that needs to take place. How do you bring those norms and those cultural aspects into those discussions? So this is where they're saying this is another area that comes into that organizational aspect of the training. So it can be very beneficial that we can bring these experienced individuals as well as the onboarding so they get that sense of belonging, creating that sense of connection. So as these new employees come on, they get, I'm getting some career kind of mentoring and planning on how to do my job the most effective way. It's also important is what type of job it is. Is there face-to-face relationships that need to take place, client interactions? So this is what we call a work-based activity, understanding what the work is and what are the activities and how do we support it from an organization, environmental, and technology perspective. So the last is moving in designing training programs here. And providing supplemental resources. Managerial training is really important in how they need to manage their VO and the hybrid workers. So this distance management, excellent studies have been done from one of our colleagues, Professor Christine Ibsen out of Denmark. They looked at how that change in distance managing really influenced and kind of stressed out the managers. These were new activities and roles that they were not familiar with. So it is important for managers to have training, understand how they're going to set up those roles expectations. How am I going to mentor my employees? How am I going to create a sense of trust so that they also know that they have a sense of connection and belonging with the organization? How do I create engagements on an individual and a team level? So when we look at the experience with the VO study, it was important to the team to have a day in the office. They wanted to do face-to-face, they were deciding it, or they could possibly meet in a satellite hub, which they're finding when teams are close, where people live, that this is another opportunity. One other area that the managers need to be trained in is developing and supporting those boundaries. We know mental strain is very high for people that feel that they're not engaged with the organization. So not only do we have physical stress, we have the mental stress. This is why we measured it. And we want to prevent that burnout, that you are out of sight. But we also, on the flip side, don't want people to feel that they have to always be engaged. Now I've noticed on emails, at the bottom of emails now, people will say, my working hours are from 8 to 5 Eastern Standard Time. And so if the email comes in after that time, then they have the permission, the employee has the permission to disengage. But managers need to support that and provide the right resources and directions in order for the employee to feel that they can move forward on this. The use of technologies and equipment, the technical IT, it's not only the support, but the training. How do I set it up? And it's a continuous learning because technology will always change. How do we set up an arranging of work environments? Well, one thing that we did with this one, since we were not sending home ergonomically designed chairs, is we kind of came up with sort of what we call simple solutions, but also having them engage in their work environment to set up a standing and a sitting position, adopt healthy work breaks. And also learning that as many of us had children at home, learning at home, we needed to set up some house and office rules. How do you signal to the rest of your family that, okay, I'm doing heads down, can I go into my office, shut the door, putting out a little calendar of when I'm not available? All of those are ways that managers can help employees set up what we call kind of the house rules. Now, when we move into ergonomic assessments, tele-ergo is happening now. Many companies are offering Zoom calls with an ergo expert to help them show and look around their work environment. What's important, though, is to make sure, just because the employees are working at home, that we still protect their health and safety. We make sure that if there's any discomforts, they need to know, employees need to be reinsured that they can have early report of discomforts. We're still doing the health and safety surveillance, even though they're not in a conventional office space. We need to provide resources for them and provide quick aids and tools. And many companies are setting up quick little training programs now, and you can get a live chat, work with the ergo expert or the safety and health. And also what was important is a lot of the VO employees said that they wanted to create a VO network where they could reach out and hear the creative solutions that other people were coming up, their coworkers were coming up with. So that can kind of get a sense of belonging, setting up the culture. of a very positive culture and embracing the norms themselves. These are just some examples of different ergonomic training that we have. So we've broadened these out to remind people of taking their mental and the physical breaks, how to schedule your virtual meetings so that you get a natural break. So you're not just going from 1 hour to the next hour. Everyone needs time. We don't want people moving into Zoom fatigue. So that's also encouraging and incorporating that in. Being aware of how much time you spend on tasks now that we have all these wonderful Fitbits, using those to allow you control over your work organization and over your physical environment. So creating those work boundaries, learning how to separate the home so we, the blurring, what we call the blurring of the work life is important. So it's going to change day to day, possibly what the tasks are. And another thing that some of the successful practices is in the VO study, what we also found is that people were really learning about each other in a different way, because now that they would come together on a teleconference, they were learning more about people's hobbies and interests as just a way to kind of get some team synergy. And I bring this in as a participatory process. This is on the CPH-NEW, something that we've been working on for many years, is setting up a process, a healthy workplace participatory process and a program. And this is a wonderful opportunity for all of us. I mean, from a health and safety and ergonomic perspective, we could seize this opportunity and really help organizations how to do these right turns. Now that we've had the mandatory working at home, we're slowly opening things up. Why not bring in a key team of managers and key decision makers along with employees that need to have a voice in how they want to work? So this is one model that we use in our participatory approach. On the CPH-NEW website is excellent templates, worksheets to allow a group to go through these various steps to identify what their issues are, how to come up with creative solutions, establishing KPIs, what are going to be some particular interventions, selecting those, plan them, and constantly monitor and evaluate so we get sustainability. I would encourage you to look at the material on the CPH-NEW because this is a very powerful tool to bring the right people together. And as we conclude here, here are some challenges and solutions. We've discussed many of these on the left-hand side. Here are some of the solutions: engagement, opportunities, looking for those opportunities for teams to work together. Looking at the workspace design, we're going to see collaborative workspaces, huddles, flexible work environments as a hybrid environment is going to be slowly moving in. Setting up those work-life balances, routines, different ways of working, distance management. And then with performance and goals, what was interesting is that as the managers really had to sit down and work with their employees one-on-one to set up those role expectations, what it meant by decision-making, job autonomy, how do they set up feedback, how do they set up those performance expectations? That's all really good, optimal management work styles. So I'm going to take a pause there, and I think Siobhan is the one that's going to be leading any questions to entertain.
Are you back, Suzanne?
Not in the chat, so I'll leave
Not in
it
the
to
chat.
you to.
Yeah, no problem. So we do have like a few minutes for questions. I don't see any questions that have come in the chat, but there's lots of comments that have been shared by participants around maintaining physical activity while working remotely, the need to account for workers' compensation insurance coverage, especially for employees that choose to work out of state, and people also sharing some of the other benefits of teleworking, like dollars and time we save by not having to commute. So those are a couple of the comments that have been shared. So I'll just wait another second to see if there are a few questions that folks have that they'd like to submit in the chat.
Those are very important points that you were raising. This was something that definitely the public sector organization was looking at, because they were in 2 major East Coast cities, and they didn't share that data with us as a research team because the union felt that it was too individualized, but they were looking at, as people were moving back home, there was that reduction in commuting, which moves into the ecological benefits. This is something definitely that they were encouraging. So even if you move to 1 day a week and coming to the office, then you're not having that environmental impact. So those are all very important, what I would call societal outcomes that were actually being investigated as well.
Thanks, Michelle. We have not received any new questions, so make sure to continue to monitor the chat, but I think that we can continue on.
Okay, and what we will be looking at here is I will be providing some links. This is an open access article. This was my former role of the International Ergonomics Association on the Executive Council was outreach, and we were asked by the International Labor Organization and WHO. We collaborated on coming up with working from home, human factors ergonomics consideration for telework. That one is published on the IEA website, as well as there's another collaborative effort between our 3 organizations that should be coming out at the end of the year. And so this gets into, both of them gets into all the systems components that I discussed earlier in the webinar. So these will be very good guidelines, and especially because we worked with world organization and leaders. So we're very excited about that. That's what I was saying for our occupational safety and health ergonomics area. We are really playing some very key pivotal roles in helping organizations move into these different work styles. The Boston College Center for Work and Family has a very nice 2-page kind of description. It takes in what the 4 dimensions is, looking at the employee, the group, and looking at the organizations and the manager role. So very similar to the systems model that was presented here. And then there's a book chapter that I wrote that looked at how we manage the safety and the performance. And the last slide is we will be sending around the ergonomic tips and guidelines that we developed that was used in the VO study, as well as the other office ergonomic intervention studies that I have participated and directed. And we also, for the Human Factors Ergonomics Society, we kind of have what we call a 12-step checklist that kind of helps people set up the work environment, healthy computing habits, as well as the psychological aspects themselves.
I wanted to share, Michelle, that we do plan to circulate a form of this slide set plus some of the materials that you just pointed to following the call, along with an evaluation survey that we hope you all elect to do. And
Yes.
This slide just shows if you want to get in touch with our center. I think Siobhan gave contact information or the website earlier for the mawow.org website. And we are happy to hear from anyone participating in the call. And we are very grateful that you joined us today and hope that you enjoyed the session. Any other parting words, Siobhan and Michelle?
No, this was great. And I also want to just thank Michelle for an excellent presentation. Thank you so much. This was very informative and valuable to our work.
Excellent. Thank you very much. And I really appreciate everyone joining. And best of luck to everyone in their organizations as we embark on a whole new way of working.
If you're interested in this topic and others, we would like to hear from you as well. We're going to also continue doing webinars. Siobhan, you've got yours quarterly. We'll also be starting a new webinar series for total worker health topics called Trends.